Hey guys, my name is Grace Rowe. Thank you for joining us today for another interview about everything you need and want to know regarding COVID-19. This is a really uncertain time, and so I've teamed up with the New South Wales Government, and our goal is to help you by bringing clarity and understanding through honest and factual information. It's really hard amidst social media and the multiple different articles to know what's real and what's not. And that's why today I will be talking to one of the most reliable sources we can find, Dr. Kerry Chant, our New South Wales Chief Health Officer. Thank you, Dr. Chant, for your time today.
Thank you. It's a pleasure, Grace.
So firstly, Dr. Chant, things seem to be changing almost every day, and it can be a bit hard to keep up with it. Could you give us a general overview of COVID-19 at the moment?
So, Grace, what we saw was early on we had a lot of cases in returning travellers. And we've seen gradually we've introduced border measures so that everyone, we've limited the number of travellers returning from overseas, and now really only Australian residents are returning home. And they're returning home in smaller numbers because a lot of people have returned much earlier. So we're still seeing some people returning, but the numbers are much lower. We're actually accommodating those individuals in hotels and quarantining them for 14 days and watching them for symptoms of COVID-19. If they develop symptoms, we swab them and test them. So in terms of our, we're no longer getting that rush in of overseas acquired cases. And then the main issue that we're looking at now is local transmission. And there's two sorts of local transmission. There's where we might have a case in a family and there's a person, they've transmitted to their household contacts. But the next one that gives me greatest concern is where we've got cases popping up and I don't know where they acquired it. So they don't have links to a known case, they aren't a returning traveller, they're not part of a broader cluster, they didn't attend an event or have any links. And they're what I often refer to as a locally acquired no epidemiological link group. They're like a canary in the coal mine. You know, every time I get one of those cases, I'm trying to think, is there more people in that community? How did that person acquire it? Can we really lock down and stop any of those transmission chains occurring? So at the moment, our numbers are low. They represent a small number of overseas acquired, mostly amongst those people in hotels, in the quarantine hotels, and a small group of contacts of known cases. But then that group of locally acquired, not linked cases, and they're the ones that I often say, you know, there's a case in Penrith, there's a case in Waverley, go out and get tested around you. And our contact tracing team does all our efforts with the cooperation of that positive case to map down and track all of the contacts and isolate the case, but quarantine all those contacts.
If we show symptoms of COVID-19 but we haven't been overseas, should we still get tested?
So now we're in the phase where it doesn't matter about overseas travel. Anyone in New South Wales who has the slightest sniffle, sore throat, a bit of fever, feeling a bit unwell, please come forward for testing. And that's critical because that will allow us to really understand what is the extent of this community transmission. And without the cooperation of the community, we can miss chains of transmission and really get a big surprise at the end when there's been an undiagnosed cluster. And we know that our best efforts are prevention. Like all things, prevention's better than cure or down the track. And so if we can actually get a chain of transmission at that, right when it's starting, that saves so many further cases and, you know, saves lives and is critical to our response.
With that in mind, what are some of the key symptoms that would warrant someone going to get tested?
COVID-19 is actually very mild in many and severe in some. And this presents lots of challenges. So people might have a bit of a runny nose, altered taste and smell, fever, headache, cough, shortness of breath. But some of those symptoms that I've described would be what we'd see with a common cold. Most people in the past would have potentially just gone about their lives without seeing a doctor, staying away from the workplace. Now we have COVID-19, it is critical that even those mild symptoms are taken seriously and that people go and get a test.
So Dr. Chant, how does a young person go and get tested? Where would they go for that?
So the first thing is your GP. And your GP may actually do phone consultations for COVID. They can then email you a form and then you go to a collection site. And we've even got drive-through collection sites. Then the other option is on our website, there's a whole heap of COVID clinics which are run. And also the Commonwealth Government has the primary healthcare networks have also set up COVID clinics. So there's actually hopefully quite a lot of access to testing. And then if you're in perhaps rural regional areas, your emergency departments can also do COVID testing. So I really would welcome young people to embrace testing. It's really important that even with those mild symptoms you come forth for the testing, and it'd be appreciated if young people are giving you any feedback that it's challenging, or we can present the information in better ways. But urge you to go to our website. Testing is easy and we're continuing to try and innovate in the ways that we're testing.
If a young person is tested, is it important to self-isolate before they receive their results?
We advise people, if they are suspected of having COVID, like even with those mild symptoms, that you do self-isolate. And I just like to reassure young people that we've really improved access to testing. Our turnaround times are much greater than they've ever been. So generally your result can be done, if you're really good and get in early in the morning, you can sometimes have your result that same day, but generally within 48 hours. And so we really would ask you to self-isolate at that time. Now that doesn't mean that you can't go out into your backyard, you can't even walk around, but stay away from anyone. Stay that 1.5 metres away if you go for a walk. The more you can self-isolate whilst you're waiting for the test, we would greatly appreciate it, and that's what we recommend.
If you do get tested and you're positive for the virus, what must you do and what treatments do you need?
So people with COVID can have very mild disease, so it really depends on the severity of your disease. We'll obviously watch you closely because we know even with some young people that they can get sick later on. So it's important that you're linked to a healthcare provider, that you're monitored regularly, and if you have any deterioration, that you get another level of care. But many people, actually almost 3/4 of our cases currently, are being managed outside a hospital environment. Many are at home and recover, but we do know that some have more severe disease. There are people, even quite young people, that have been admitted to ICU, that's our intensive care, and whilst there's no drug therapy that is highly effective, there are some drugs that may be tried on you, particularly under sort of clinical trial framework. But when you're in intensive care, what's most important is good intensive care. So providing you with some support in your breathing, such as giving you some oxygen. It may involve putting a tube down your throat. And just that supportive care is actually what many people, or a small proportion I should say, of the people need to get them through and come out recovered and healthy at the end. There will be some people that have some residual complications from their illness, but as I said, particularly for young people, the disease on average is very, very mild, and it is only just in a small group that have the more severe spectrum, but it's very important we take it seriously.
Are there precautions we should be taking when visiting someone's home?
The key message is you shouldn't go if you're sick, and that could be really mild. So if you would even have that tickly throat, that runny nose, it's not the time to go and visit. What you should be doing is booking in for your COVID test, seeing your doctor, or going to one of the COVID clinics. We're suggesting that you wash your hands when you go there. If you've got a hand sanitizer, sanitize before you go into the house. Make sure that you try and socially distance as much as you can, and enjoy yourself. What's most important is that we know that human interaction's got lots of social benefits and important is for well-being. So enjoy yourself, take those opportunities, but just take those very simple precautions to keep everyone as safe as possible. We have been seeing some of the downsides of the restrictions in terms of people feeling disconnected, potentially anxiety levels raising. So we think that social interaction and keeping those meetings of well people. I'd like to stress it's important that all of those people are well, but if they're all well, it provides that opportunity of getting together, catching up. And particularly if you've got any elderly people that you're meeting with, think about, and it's a nice day outside, or there's a bit of a veranda that's lovely and warm, think about having those opportunities to meet with them in outdoor environments, because we know the risk of transmission. If you are unknowingly infectious at that time, it's less likely to transmit in sort of those outdoor settings.
Is this a sign that more restrictions will be lifted soon?
It's been really pleasing to see that we've got low levels of community transmission. It's important that we strike this balance between more widespread community transmission, which will inevitably lead to more people with COVID-19 and potentially more impact on hospitals and have an impact individually on those people, versus the importance to keep us healthy and allow us to interact, allow the economy to progress. And so we'll be trying to calibrate our response as we navigate through COVID-19. But how well we do is really going to be a reflection of how the community, including young people, respond to the public health measures. If we get high degrees of compliance with the simple measures, which sound so simple, just, whenever you possibly can, stay 1.5 metres away. Don't go and visit people, don't go to workplaces, don't go and visit people in hospital if you're unwell. Just those simple measures, if the community keeps embracing testing, goes forth and test, it will allow us to keep a much better control on any community transmission of COVID. But it is going to be this interaction between the community's responsiveness, when we call out for the community to take those actions, will allow us to have a little bit more flexibility in terms of the level of restrictions.
I assume it's quite hard to say, but do you have any idea of how long this will go for?
I think this is also a really challenging message to get across, but COVID-19 is going to be with us for a very long time. At the moment, we would be wishing that we will have a vaccine as soon as possible. So some of the estimates, and they're probably optimistic estimates, is that we'd have a vaccine in about 12 months' time. And the things that give me optimism is that the community, the international community, academics, research entities are working as hard as possible to find a vaccine. And unusually they're doing things like concurrently making vaccine at the time when they're actually trialling vaccines. And so everyone is doing everything possible to condense the normally many, many years it takes to develop a vaccine. So it gives me some comfort that we may see a vaccine in that 12-month period. But until we have either an effective drug or a vaccine, or enough of the community get infected, we will continue to be subject to COVID-19 upswing in cases that are going to be requiring us to do these public health measures all the time to control them. So I think at the moment what we're doing is looking at our next few months, and we have to keep on reassessing what vaccines are showing promise, where are we up to, have we seen any new drugs. But this time has also brought us incredible time to prepare our hospital system, obtain enough personal protective equipment, ensure that we've got enough tests to really ramp up and respond.
Things seem to have calmed down a bit. Does this mean that we're allowed to hang out with our friends in small groups?
The current outdoor restrictions are still in place, and I can't preempt what governments may choose to do in the coming weeks. It's important that we keep a close eye on the numbers and how we're travelling. And we also need to know that whenever we do something, the data doesn't actually reflect it immediately. So what happens is it probably takes about 3 to 4 weeks before we actually see the true impact. And that's because of what's called the incubation period of the disease, which can be from a day to 14 days. So because of that, it takes a few cycles of weeks and weeks till we get enough cases or we see the impact of those easing restrictions on case numbers. So we're trying to work through a whole range of restrictions and lifting restrictions that where there's a low public health risk from changing the measure, but where there's a really positive for community wellbeing and also with some economic impacts.
Some young people may feel inclined to not attend their doctor's appointments or not attend healthcare clinics because they're afraid of catching COVID-19. Is this something that we should be legitimately concerned about, or is it okay?
I would really encourage young people to continue to seek out healthcare and also to continue to get those vaccines, to seek out those preventative health test. What we're seeing in some of the other countries is that there's real concerns that people are neglecting their health because of fear of going into health facilities. And I would be really, it would sadden me if that was how people felt in Australia. So just to reassure you that GPs have taken a lot of steps. I don't know if you've rang a GP, but when you ring, they actually ask you about COVID symptoms. They have particular ways of managing people that might have respiratory illnesses to make sure that patients that are presenting for other illnesses don't come in contact with people that might be presenting with COVID illnesses. Also, they're also doing things like telephone and video link conferences. So there's a variety of different ways that you can safely access care. It's very important that you don't neglect some of that preventative health that is so important to keeping young people healthy.
We know that a staged return to school will commence soon. What are some key things that young people can do to make sure they're safe when this happens?
Again, don't go to school if you're sick. You know yourself. If you're feeling in any way unwell, now's not the time to soldier on. Please just go and get a COVID test. We're going to really prioritise students and teachers for that testing, and that will give students and teachers added assurance that we will get on top of any cases in students and teachers. I would also then say basic hygiene messages: wash your hands. Socially distance if you can. There will be a lot of hand sanitizer and other aids in the classrooms, and they will also do things in the classrooms about keeping you as distant as they can. Obviously, you don't need to be 1.5 metres away. That's not practical in some classroom settings. But there will be things like staggered timing of lunch and recess. They won't be having assemblies where everyone's crammed in. There'll be particular arrangements where, the teachers won't be clustering together in the staff room. And there'll also be the use of outdoor spaces whenever that's appropriate to the learning environment. So schools are implementing a whole raft of measures in order to really minimise any risk of transmission of COVID-19. And also parents will have to do things a little bit differently. We're really promoting the kiss and drop, and also promoting the fact that the parents don't mingle with each other, because we know that adult to adult transmission is more likely in the setting of COVID.
It's been a long time since many children and young people have seen their friends, so at school, are they allowed to hug when they say hello?
Oh, that's a really hard question. But look, I think at this time, let's just show our endearment for others in maybe virtual ways. And young people are so good at that. I think, look, just try and adopt some of the measures. I think practice some of the measures that young people need to be adopting in the way they interact with adults and other children in other settings. So let's just try and keep that social distancing within reason. But please express your care and concern for each other, because that's one of the strengths of being at school, and I know many young people are missing their friends and that the sort of social aspects of school as well. I'm sure they're missing the teachers and the work as well, but I know you've been doing a lot of hard work online.
If school does go back, do students need to be scared of catching COVID-19?
Students, at the moment, the level of community transmission is very low. We know that young people are underrepresented in the COVID cases depending on the number of young people in the population. So they don't represent their population share in our numbers. So young people don't appear to be as affected as commonly as other age groups. The disease is often milder in young people. Young people need to be respectful of COVID. They need to not see themselves as bulletproof. They need to play their part in preventing the spread of COVID. So those simple measures such as the social distancing, the hygiene measures, not going to school if you're sick, they're really critical to us on this journey through COVID.
Do you expect to see an increase in diagnosed cases of children and students when school does return?
I think the cases in students depends how we're going with the community transmission, because I think students and teachers are members of that community, and so it will depend a little bit on the community transmission or those locally acquired cases that will pop up from time to time. So I'm expecting that there will be cases in students and teachers by virtue of those community, that they're members of the community, and we will respond in the way we did in term one, where we will generally close the school down for a day. That allows us to identify all the contacts of the case. We will then isolate the case and get them linked to care, and we will then quarantine the contacts. So the contacts of the case will go into those 14 days, and then school will be cleaned, and then school will resume.
So school's resuming and we'll have a staged commencement, but do you know anything about universities? Will they be waiting longer, or will that be individual to the different?
I think the universities are considering their approach to COVID, and that's something that we're often in discussions with the universities about their approach. It's been pleasing to see the transformation for universities who have rapidly moved to online, but we also know that some teaching and training can't occur online, and I'm sure that we'll be working with universities and TAFEs around how we can support those people that need to have that more face-to-face, hands-on training and school development.
As we approach the colder months, will the diagnosed cases of coronavirus increase?
It's a really good question, Grace, and I think the magic answer is we don't know, but we do know that diseases such as influenza and some respiratory viruses are more common in winter. And again, we don't really have an answer for why, but some of it may be related to the fact that when the weather gets a bit colder, we tend to congregate indoors more. We cramp around the fireplace and into more close proximity, and perhaps that facilitates the spread. And we do have evidence that it does spread more readily in indoor environments. So the same number of people indoors presents a greater risk than if you were in an outdoor environment. So we are watchful of that, and if I had to hazard a guess, I'd say that the colder months do pose more challenge to us.
And lastly, Dr. Chant, what are some messages that you share specifically with your own children about COVID-19?
Oh, that's a very hard one, Grace. shouldn't call them children because they're actually young adults, so they will reprimand me for that. But my young adults do sometimes entertain me with the brilliance of young people in terms of the photoshopped images and memes that they give me. And I think I just sort of reassure my children that we will, you know, Australia is one of the best places to be at this point in time. We have a great healthcare system. We have a great community that responds to the messages and takes things seriously and is thoughtful and responsive. And we have the opportunity to have an open and frank dialogue with the community about how we're going to journey through this. So I'm often, you know, reflecting on how grateful I am that I live in Australia and how proud I am about a healthcare system that in general has incredible access for everyone. And for me, that's, as a public health doctor, that's probably one of the best things you need in a setting when you're tackling an infectious disease.
Well, thank you so much, Dr.
No
Chant,
worries.
for your time today and for answering our questions. Thank you, Dr. Chant, for answering our questions. Remember that during this pandemic, it is important to listen to advice from reputable sources. If you would like more information about the virus, please visit the New South Wales Government website by searching New South Wales Government COVID-19. If you feel unwell, it is important to tell someone and speak to a health direct or registered GP for advice. It is normal to feel anxious or upset by COVID-19. If you have been affected by the contents of this video and would like to talk to someone who can help you through these uncertain times, please contact the organisations on the screen who can offer you free counselling and advice. Thank you for watching this video, and thanks once again to Dr. Chant for taking the time to answer our questions.